Every year, tens of thousands of veterans finish their active duty service. Many of those veterans will face significant difficulties readjusting to civilian life. The Veteran Sponsorship Initiative is an evidence-based program designed to help.
Hi, my name is Dr. Joe Geraci. I served for 20 years within the U.S. Army as an infantry officer before retiring and become a psychologist within the VA. Right now within the VA, I serve as the principal investigator for the VA's Veteran Sponsorship Initiative, or VSI. The VSI is a public-private partnership between the VA, U.S. military, states, nonprofit organizations, and local community partners, with all partners focus on the mission of successfully transitioning service members and also helping them to navigate the deadly gap.
When service members move from station to station, the military helps them find housing, their medical care transfers with them, and the military community provides support to them and their families. But what happens during the last transition from active duty to civilian life? During this first year, veterans often feel a sense of isolation, and the risk for suicide doubles. This is what is known as the deadly gap.
People often have support during their PCS transitions, but for that last transition out of service, we are here to help to make sure nobody gets left behind.
The VSI has 4 key components. The first component is enrolling active duty service members during their transition process. For example, here at Fort Hood, they enroll more service members than any other military installation.
The second component is to utilize predictive analytics to identify service members who are at high risk of suicide. Until recently, it was difficult to know which service members were in need of critical mental health care.
But now, with advancements in artificial intelligence and machine learning, along with the work of our academic partners and the U.S. military's study to assess risk and resilience in service members, we can identify the top 30% of veterans who are most at risk. Within that top 30% are 93% of the suicides that would have occurred within the first year after transition had VSI services not been provided.
The third component is matching high-risk service members to volunteer peer sponsors.
At the national level, sponsors are managed by Onward Ops. At the local level, they are managed by a network of community partners. These partners have been brought together under the USAA Face the Fight Coalition.
We have a large multidisciplinary team all united to serve veterans and their families.
The last component is VSI rapidly and seamlessly bringing VA care to the highest risk service members. As we know that access to VA care can be protected for service members during their transition. One innovation that the VA created was the National Virtual Care Clinic for transitioning veterans. This clinic brings VA care immediately to service members and has care such as primary and specialty care services. The next steps are expanding VSI to more military installations and to more community partners. So together we can truly bridge the deadly gap.
Our research shows that service members engaged in VSI have significant increases in social support and access to VA care, as well as reductions in reintegration difficulties and suicide attempts.
The main purpose of VSI is ensuring that no service member gets left behind.
We are here to support and bridge that gap so no one gets left behind.
Let's make sure every veteran is welcomed home the right way.